There are many horses out there who don't like veterinarians. So, if your childhood dream was something like, I want to be a veterinarian, I will help horses and horses will love me, they probably won't. But there is a thing of how we can help our horses and other equines, like veterinarians, a little bit more, and how we can train them to cooperate in their care, which means that they become willing participants in their care. Hi, I'm Dr. Katarina Junghanzová, a former equine veterinarian who now specializes in equine cooperative care and ethical training. In my practice, and also as a vet student, and even before as a little horse girl, I have seen many, many horses who didn't like veterinarians to the point when they created really dangerous situations. And I have seen several times people getting injured when trying to help an injured or sick horse. And there is a study that was published by BIVA in 2018, and it revealed that being an equine veterinarian is the most dangerous of all civilian professions because of how many work related injuries equine veterinarians sustain per their career, right? So, and you might think, okay, this is because we work with horses and horses are unpredictable. Horses are strong. They still have their flight response strongly encoded in their genetics. Well, that's partly true, but that's just a part of this whole problem. In one of the previous videos, I talked about the fact that many problems are caused by horses not being ready for these situations. And in this video, I would like to be more specific about equine cooperative care and how to actually get our horses ready for the basic procedures such as daily handling or daily care, all the way up to cooperating in vet procedures such as injections, deworming, wound cleaning, eye medication, what else? Farrier care, you name it, right? So horses can become active participants in all of these situations. And by saying active participants, I don't mean that horses learn to simply tolerate it. I hate it, but I tolerate it, this kind of way. No, active cooperation or voluntary cooperation is something else, is one level further than just being someone who tolerates whatever needs to be done but would rather be somewhere else. When I speak about equine cooperative care or about horses cooperating in medical procedures, I think about the horse as being an active, willing participant in this situation who knows what to do and who knows that they also have choice to opt out and knows that there's something in it in this situation. So I think knowing about and practicing equine cooperative care is so important for every horse person, every veterinarian or equine professional, because it truly helps us take care about horses' health more easily, safely, ethically, and with less stress for everyone involved. So, whether you are a horse owner or a veterinarian, you really don't need to fight against the horse every time you need to get them injected or every time you need to give them their deworming or give them their eye medication. You can teach horses to participate in these situations instead. Now, how? Cooperative care is based on the positive reinforcement training, aka clicker training or reward based training. In one of my previous videos, I talked about how horses can be clicker trained to cooperate in their care, and this is exactly it. So, if you want to start training your horses or your donkeys or your mules to cooperate in their care, they first need to know the basics, the foundation of positive reinforcement training. because it is different from the traditional training when we basically work with pressure and release, no matter which method or training technique or training philosophy we follow. It is all based on pressure and release, no matter how we name it. But positive reinforcement training is something different. It isn't a method, it is how horse's brain works, just like pressure and release in general. So positive reinforcement is a whole other training system. And it is different from working with pressure and release. So that's why before you even start training your horses to cooperate in injections, deworming, whatever procedure, they need to know the foundations of positive reinforcement training. So this is really the foundation they need to know. They need to know what I call the default position, aka food manners, aka how to behave in the presence of food rewards, right? So this is the very basis. Then they need to learn several different things that make the building blocks of future cooperative care. So, touching a target is a very useful thing. Coming to a mat, very useful thing. And from this, you can then start building cooperation. And a huge part of cooperation is consent. Cooperative care is consent based care. So it means that we not only teach our horses to just stand still for an injection and then give them a treat. It is not enough for horses to learn to cooperate, especially if the procedure is aversive, such as injections. So, consent is a big part of this. So, as the next step, when the horse understands the basics of positive reinforcement, and of course, it requires that you understand the basics of the positive reinforcement training, then the horse needs to understand the concept of consent, the concept of pressing that star button, whether it is an actual start button such as target when the horse comes and touches the target, or whether the start button behavior is something else. So the horse needs to understand the concept of consent, and then the horse can learn to cooperate in specific procedures, which means that they learn specific behaviors that makes taking care of them easy. So, for example, they can learn to come to a certain place where the procedure will be done. So, instead of you physically manipulating the horse to that place, which can already increase their stress level before the procedure even starts, before the vet even comes near the horse, you can ask the horse to come to a certain place where then the procedure will be done. So, this is a simple cooperative behavior that you can train with your horses, and that is really practical. Honestly, I think that cooperative care is the modern way of taking care of our animals' health. And if you want to learn more about the principles of equine cooperative care, I have a free online course for you called The Introduction to Equine Cooperative Care. I will put the link down below this video so you can check it out and learn more about the principles. And if you want to start training your horses to cooperate in their care, then every once in a while, a few times a year, I open my signature program called the Cooperative Care Intensive, where I will take you on a journey and I will guide you through teaching your equines to cooperate in different procedures, in the most common procedures such as deworming, wound cleaning, clipping, spraying, or injections. And this online program opens just a few times a year, and the next cohorts will open in September 2026. So if you don't want to miss it, make sure to click the link below and either join the program or sign up for the waitlist, because this program only opens for a small group of students, because I am guiding you guys. It's a live online program, and I will give you feedback on your training videos, and I will answer your questions. So if you want to start with equine cooperative care and you are serious about training your horse to cooperate in their care, this is the right place for you to be. So click the link below and check this program out. Thank you so much for watching. I hope this video helped you get more clarity about what equine cooperative care is. And if you are interested in learning more, don't forget to subscribe to this channel and check my free online course that is called The Introduction to Equine Cooperative Care. See you in the next video. Bye.